This is the exact place we are told the late Ruth Eshun, the 37-year-old nurse who worked at the Sewa Health Center, was allegedly murdered and dumped here. We're also told that she struggled with these assailants before they were able to perpetrate that dastardly act. And this place we are is a path she's been using to work. Usually her husband drops her at the workplace, but sometimes when he's not able to, she uses this place because this is shorter to where she can find vehicle to her workplace. We have come here to speak to relatives of the deceased to find out from them how they received this news and what they want to be done about this incident. Let me go close and speak to husband of the late nurse. How did you receive this news about the death of your wife?
So on Monday, when I came home around 5:30, my wife had not reported. Our first two children had come back from school. They were at home. I was worried because my wife usually comes back home latest by 5 p.m. But I go home around 5:30 and she wasn't home. So I started making calls to find out what was happening. Earlier in the day, she told me she will be going to Kumasi to withdraw some money. So initially, I thought she had been held up in traffic. But when I realized she was not coming, I went to pick our last born who attends school just close by. I came back home around 7 and she had still not come back. I made several calls. At 9 o'clock, I had to go to the police and make a report of a missing person. So when I got the extract, the whole night, I moved from police stations and hospital emergency centers all over Kumasi. So when I got to Manshia Emergency Center, I got a call from a nephew whom I stay with, or who stay with us. She told me that they have found the banknote and the voter ID card of my wife in a bush just close by our house. After that call, within few minutes, I received another call asking me to quickly come back home. So I got really worried and I sensed the danger. Then after a few minutes, another call came with somebody crying on the phone. That's where I got to know that my wife has been murdered. I want swift investigation. I want very swift investigation to be done. I know they're trying to do their best. They were here on Tuesday. Friday, they brought the accused person around, the only accused person they have arrested, and conducted what they called a crime scene reconstruction. But I still see the investigation to be slow.
The death of Ruth Eshun, a mother of 3, who many have spoken positively about, came as a shock not only to her relatives but also to the health fraternity in Ghana. Her death has risen the statistics of the number of women murdered under mysterious circumstances to 6 from 2019. This has sparked outrage, especially on social media, as many are calling for justice. One notable group pushing this agenda is the Ghana Registered Nurses and Midwives Association.
In fact, ever since the occurrence of her death, we have been having meetings with the police. Last Friday, we were here and we made to understand that we should come today for a briefing. And that's exactly why we are here. So we are all here to ensure that the needed justice is given to our colleague who have died so suddenly.
You just finished a meeting with the police. What's the assurance for you?
Yeah, You know, they are the people that are being mandated by the state to ensure that our safety are being cared. And as such, they are the people that will only unravel the mystery behind this death of our colleague. And from the interactions that we have had with them, we are very sure and positive that they will make a headway.
Although the police will not give further and official information since the incident occurred, they have only confirmed the arrest of one person. At the Sewa Health Center, where the late nurse worked, red bands were tied at every corner of the facility. Health workers here could not hold back their tears when officials from the Ashanti Regional Health Directorate, led by the regional director, went to the facility to commiserate with them.
We all heard the calamity that has befallen the health system in this country. A nurse who has closed from work and is going back home, to be killed in that manner is unacceptable. And the healthcare fraternity is really concerned about it. So we are here to motivate and encourage them on behalf of the minister and then the director general that the police are on the investigations. So we should remain very calm. Everybody should remain very calm while the investigation is going on, so that we can continue to do the work that we've been assigned to do. We should remain very strong and courageous at this time. And then we shouldn't fear, because anytime we panicked, it will disturb the work. Most of the work that we do here is basically home visits, sometimes going from community to community. So the moment they feel threatened, it will affect the way they deliver the service. So we want to encourage them to stand firm. And we are pleading to the police to expedite the investigations so that the culprits will be apprehended. And then the necessary justice will be done to the family, to the health system, and Ministry of Health in general in this country.
Police in the Ashanti region say they are still investigating the suspect who is in their custody now, and they are also reaching out to husband of the deceased to assist them in their investigations. For now, they want to hold on until they follow up on those leads they are picking, and also when they get full details of the facts and they are able to speak to the media. Reporting from Kumasi, I am Hafiz Tijani for Citi News.